welcome to the second video on my channel. So this patient came to me actually yesterday, in fact, and on the face of it, it looked like a fairly straightforward wax removal. The wax was quite dark, it was completely filling her ear canal, but she was getting some extra kind of symptoms around her own voice resonating quite a bit, so that's what we would describe as the occlusion effect in audiology. So I proceeded with caution and just sort of used the microsuction probe in the first instance, and there was some movement on this wax. I was quite confident that I could remove it all in that appointment. However, it just needed quite a bit of manipulation. What I suspected was happening was there was quite a bit of keratin, keratin buildup mixed into this wax, a sort of an epithelial debris. Now, the ear canal cleans itself via a process called epithelial migration. So the skin in our ear canal is a very thin membrane, and it's constantly shedding, and it's trying to push wax and debris out of the canal. Now, it's not a perfect mechanism, and with age, our ear canals can lose their shape and elasticity. So this patient was quite elderly. She had quite soft skin in the ear canal. So the ear canal was sort of slightly collapsed. I sort of had to prop it open a little bit with the endoscope itself. And so essentially what had happened is that the epithelial skin was shedding, but yes, she had wax as well. So the skin was sort of concertinaing up behind that plug of wax. So this is quite a common thing amongst relatively elderly people because of the reasons I've spoke about. And yeah, I could just tell the consistency of the wax. It was soft enough to remove on the day. It just needed a little bit of extra olive oil treatment. So I use Earol olive oil spray in clinic, and the spray is key because when you spray that into someone's ears, it gets right down the ear canal. And normally I'd say to patients, yeah, use this for a couple of days before the appointment. That really does help to soften the wax a little bit. When I use it on the actual appointment day, I'm not expecting it to penetrate and really soften the wax, but what it can do is get down the sides of that wax and essentially lubricate any plugs of wax that are there. So once I did that, I got even more movement on that plug of wax, and I'm just gently trying to manipulate it and sort of guide it through the ear canal. Now, as I'm doing that, gaps are created. It's releasing a bit of pressure in the ear canal because it can sort of put a bit of pressure on the eardrum just by being there and the air not circulating properly. So yeah, I'm just working away really gently on this patient's ear, trying to make really good contact with that plug of wax. Quite often it's a case of trying to sort of wiggle, I suppose, if you want a better term, the wax around gently just to free it up from the canal wall, but doing it really, really gently, because the skin in our ear canals is pretty fragile. Like I say, it's a very, very thin membrane. But we're getting there. And what's happening is, because this wax is sort of mixed with keratin, it's quite elastic. It's very, very viscous wax, which, yeah, is quite dense. But at the same time, as you start to extract it with suction, it kind of stretches out the plug of wax, which is sort of exactly what happens here. But nonetheless, I'm working away at it. I can tell we're going to get some success in a couple of minutes. But yeah, it's just, again, that sort of wiggle technique is helping to free up that wax. We're getting more success now. Often it's a case of trying to still suction parts of that plug, because often people have a buildup of wax in the second bend of the ear canal, which is actually larger than the entrance to the ear canal itself. So you need to kind of get it into a shape that you can guide through. So we're getting there now. That wax is being extracted through the ear canal in its entirety. So I think a piece here just kind of breaks off a little bit. But yeah, we're really making progress now. And then the last little bit, you can almost see the ribbons of that dead skin that have concertinaed up behind the wax and combined with it as well. So just going back in, making really good contact. And yeah, that last piece is all coming out in one go. Just need to readjust my position there, and then we go back in. You can see it's still filling the ear canal. You know, it's the job is not complete. So it goes to show, you know, how much wax was in that ear canal, and that really, obviously, there's no way that those sound waves can really penetrate that and reach the eardrum. So you would really feel quite hard of hearing with that amount of wax in your ears. So the last portion now, just being guided through, just trying to make contact with different parts of that plug so that it doesn't break off. And there we go, last bit of skin. Excellent, so that's all clear. So in a moment you'll see the eardrum and near and that part of the ear canal by the drum. So it's looking a little bit raw in there. I've advised the patients to keep their ears dry for the next couple of days. You just need the air to circulate and for that skin to recover and get back to normal again. But yeah, again, you'll see in the next slide, I've got an image of that wax that I removed, and it's a good long piece because again, it's those ribbons of dead keratosis that was being shedded from the ear canal. But yeah, the patient felt instant relief and they were really happy. Thanks for watching.